Number one, pre-pregnancy BMI is the anchor for pregnancy and weight gain advice always. So if you are giving weight gain advice to a pregnant patient all the time, you need to make sure that that advice is based on the pre-pregnancy BMI. Number two, you also need to know the gestational weight gain ranges code. You need to know it by heart. Okay, you must instantly recognize which ranges apply to which BMI group. Now, MCQ1 also loves best advice questions. So you realize that this particular question is not asking about what number the patient should gain per se, but what best advice will you give? So you realize that this is like a core medical knowledge plus counseling case. Then avoid over-specific or formulaic traps or one-size-fits-all answers. What do I mean by that? Because that option, which was talking about 400 grams per week in second trimester, or the patient should gain X number of kilograms to reduce macrosomia, you need to always deal with the specific patient in the specific question which you've been given, because the MCQ1 always assumes you are in a real case scenario in the exam. Number 5, nutrition in pregnancy is not always equal to weight loss. A classic MCQ1 misconception trap where candidates are tempted to talk about calorie restriction, dieting for weight loss, aggressive weight control. Always remember that in the MCQ1, when you see options which look very, very aggressive, be very careful with them. When you see MCQ, like when you see MCQ options, A, B, C, D, E, and one of the options looks very aggressive, it's like, telling a pregnant woman to go on a calorie restricted diet. That looks a bit aggressive. You want to be very careful.